life from 1st January to 1st December 2021. We cannot take it for granted. We thank you for keeping us despite COVID-19 pandemic and other health issues. You are our God. COVID-19 pandemic has brought a lot of anxieties and even other diseases like HIV, AIDS, cancer, diabetes, and others are now ignored. Today, we are here to commemorate the World AIDS Day and seek for your intervention. We thank you for taking care of those living with HIV, those who are infected and affected, the orphans, the widows. We pray for our community, and we give you thanks for His Excellency General Yoweri Kaguta Museveni, the President of the Republic of Uganda, for his commitment to fight HIV. We give you thanks for the Minister of Health and her team. We give you thanks for the medical practitioners, for the AIDS development partners and religious leaders for waging a war against HIV. We pray for the ending of stigma, end of AIDS, and end of the pandemic. We pray that one day AIDS will become history. And we pray against any other things like gender-based violence. We pray against corruption, terrorism, laziness, and other vices. Help us to work together to have a peaceful world. In Jesus' name we pray. Amen.
Our countrymen and countrywomen watching us live on UBC TV Inspiring Uganda and Star TV Yegwanga, we are coming to you live from Kololo Independence Grounds as His Excellency the President joins other guests to commemorate this year's World AIDS Day here at Kololo Independence Grounds. I'm called Dennis Blair Kalanzi. The country is at the forefront to fight the pandemic, and that is Uganda AIDS Day. The Archbishop is still praying. We shall first listen in to him.
And also Chairperson of Inter-Religious Council of Uganda, Council of Presidents. Our guest of honor, His Excellency the President of the Republic of Uganda, honorable ministers here present, honorable members of Parliament, the AIDS development partners, esteemed religious and cultural leaders, the Chairperson, Uganda AIDS Commission, civil society, invited guests, ladies and gentlemen. I greet you all in the name of Almighty God and bring you greetings from the Inter-Religious Council of Uganda, the body that unites different faiths in Uganda for common action. Today, 1st December 2021, we join the government of Uganda and the rest of the world to commemorate the World AIDS Day under the national theme, End Stigma, End AIDS, End Pandemics. It is also a time when we, as Inter-Religious Council of Uganda, are commemorating 20 years of multi-religious collaboration and action. Your Excellency, the Inter-Religious Council of Uganda was formed 20 years ago. I wish, therefore, to express our sincere gratitude to the government of Uganda and other partners for accompanying us for the last 20 years in our growth. Let us clap to the Lord for them. Ladies and gentlemen, we need to reflect deeply upon the words stigma and AIDS and what they mean in terms of ending AIDS as a public health threat in our country. If we are to end AIDS, we must work together to banish the stigma that so often makes society harsh in relation to people living with AIDS. We all need acceptance, belonging, and the comfort of being part of a caring community. And therefore, receiving rejection leaves them with deep emotion wounds. We will, therefore, use our religious powers and influence to ensure that the public is not focused on the problem, but the real problems, including, among others, access to quality services and fighting stigma and discrimination. And for our conversations to continue, we need more safe spaces for dialogue at different levels of society. The lines of communication must be kept open. As one biblical verse says, death and life are in the power of the tongue. It is Proverbs 18:21. Your Excellency, as council, we firmly attest that our strong cooperation with the government and working together with all other sectors is the cornerstone of our success to reduce HIV prevalence in our country. The multi-sectoral partnership has brought us to this place right now, celebrating our incredible progress towards achieving the UN AIDS 95 targets. Our success story is one that the world needs to hear us as we are in the storm of ravaging pandemic. According to data from Uganda AIDS Commission, I am proud to say that Uganda is at 91.82. And these results indicate that Uganda is progressing towards epidemic control. We should feel a sense of pride while guarding against complacency in knowing that Uganda will soon be added to the list of African countries that will have triumphed over HIV. In the spirit of this year's theme, End Stigma, End AIDS, End Pandemics, I want to underscore the religious leaders' unwavering commitment to join government and partners to end the AIDS epidemic in Uganda by 2030. Today's commemoration serves as a reminder and a moment to celebrate our achievements. As we look to the future, we must not take for granted the progress we have made. We need to maintain the momentum, and a stable and responsive national HIV/AIDS response will ensure Uganda remains on the path to attain the UN AIDS 95 goals by 2025. Conclusion. As religious leaders, we call for strong institutional leadership and an empowered, compassionate community to prevent infection and care for those infected and affected with HIV and AIDS. We continue to invite similar leadership by government and other sectors. We acknowledge that all people have the right to health, which includes access to basic health care. We also continue to offer our leadership resources to propel our country towards epidemic control and end AIDS as a public health threat. Allow me to end by thanking His Excellency, the President of the Republic of Uganda, the development partners, and all Ugandans for their tremendous courage and resilience during the lockdown as a result of COVID-19. You know, during the time of lockdown, this pandemic, HIV/AIDS, was not locked down. So let us continue also to observe the SOPs and vaccinate as advised by the Ministry of Health. Please be assured that our dedication as a council is unwavering, and each action we take will be anchored in our strong desire to make a real difference in the lives of people living with it and affected by HIV. For God and my country, may God bless you all.
That is Dr. Stephen Kazimba Mugalu, the Archbishop of the Church of Uganda, giving his remarks today. Now, ladies and gentlemen, to remind you, Uganda is joining the rest of the world to commemorate the World AIDS Day. And like I told you earlier, that Uganda for the period between 2010 to 2020 recorded a very tremendous improvement in the fight against the HIV and AIDS pandemic. This one ranked it the 8th among the 8 countries in the world that has fully achieved the 90 target by the end of 2020. The other countries are Eswatini, there is Switzerland, there is Rwanda, our neighbor here, there's Qatar, Botswana, Slovenia, and Malawi. That means that Uganda is doing well in its efforts to fight the pandemic, that is HIV and AIDS. Now, however, the number of people living with HIV and AIDS increased from 1.2 million people in 2010 to now 1.4 million people living with HIV and AIDS. Those ones that went, tested, and were positive, according to the records from the Ministry of Health. However, now, after talking to the officials from the Ministry of Health, they attribute this to the improved access and utilization of HIV services like testing, care, and treatment. However, they also tell us that there was a tremendous reduction in the new HIV infection amongst various groups. However, when they put it on, they told us that the young people between the ages of 15 and 24, they are the ones at risk of catching the virus, that is AIDS, HIV and AIDS.
Uganda AIDS Commission. We have the DG of Uganda AIDS
We are still coming to you live on UBC TV, Inspiring Uganda. Omulungi atulaba ne ku Star TV. Tuli wano e Kololo nga tukutuukako butereevu okuva mu kisaawe e Kololo nga Uganda yeegasse ku mawanga amalala gonna mu nsi yonna okukuza olunaku lw'abantu abalina akawuka akaleeta mukenya. Kakati katusooke tufune okwogera okuva ewa director owa Uganda AIDS Commission, then tujja kubanga tudda twogera ebirala.
Ladies and gentlemen, all protocol observed. As you have been told, my name is Stephen Watita and I'm the chairman of the National Forum of People Living with HIV Networks in Uganda. I'm going to make a statement, but I want to request any person living with HIV who is around, if you are able to stand up so that the president can see you. that we are Ugandans living with HIV, but we are well, and by the grace of God, we are able to attend here. Thank you very much. As a constituency of people living with HIV, we are grateful to God and thankful to our government and to your government, Your Excellency, and welcome partners, PEPFAR, the Global Fund, that as we commemorate this World AIDS Day this year, 2021, we have over 90% of Ugandans who are living with HIV, they know their status. And most of those, about 90% of those who know their status, they are on ARVs. I personally have been on ARVs since 1999, and indeed, if it was not for PEPFAR, I wouldn't be here to make this statement. So we know that, however, not all people who are on treatment are doing very well. Less than 90% of people living with HIV are not doing very well, and one of the reasons is because of stigma, which is our theme for this year's commemoration. We are aware that stigma is a major structural barrier and plays a major role in influencing people to seek services, which are widely available, thanks you again for the arrangement through the Ministry of Health, and freely available all over the country. Many of these people feel ashamed. They cannot, for example, stand up when I say you stand up, and we will not introduce themselves as people living with HIV who need help. But we know that when these people who are living with HIV are put on treatment and they take the medicine with good adherence, they actually do not die of AIDS. Most of these are not dying of AIDS. Some of us were dying of AIDS those days, but now we are living fairly good lives. Secondly, these people do not transmit HIV. Science has shown that if people living with HIV are put on treatment, and they follow the treatment, the ARVs, with good adherence, they cannot transmit HIV, including passing on the virus to children. We have seen this dramatically happen in Uganda. We have very few now, although we are not at zero, but we would like to encourage all Ugandans that because there is no cure yet and no vaccine, and treatment is for HIV is treatment for life. You have to swallow these medicines every day the way you eat your kaunga every day, and you add this to the list of things you do every day. We will continue to thank the government and the development partners for the good job so far done, but we request, Your Excellency, that the over 1.3 million Ugandans who are on treatment are helped. They need what we call treatment literacy. Treatment literacy means understanding how to swallow medicine when you are not sick, because we are not sick people. Not all of us, of course, but we have to take this medicine every day. The advent of COVID-19 disrupted many of our services and they affected us adversely because many people went off their treatment during the unprecedented lockdowns, including some who could not swallow their medicine because they didn't have food. Some people called us and said, we cannot swallow medicine because we don't have food. We would like, therefore, to appeal to your government, Your Excellency, that people living with HIV who are known and they are registered in the over 1,800 ART centers around the country are put on the list of people who are vulnerable, so that when assistance during times of emergency is given out, they are not asked to go and register again. Because sometimes when you go to register, we are stigmatized, but we are already registered. And the minister can testify to this, that we are known. So we can just be called and our numbers are known at our ART center to be given this help. On a positive note, we know that there are interventions that have worked for us. These include addressing stigma, which we are focusing on today, through economic empowerment programs, where people living with HIV and those affected by the disease have freely formed and sustained community saving groups. We have had and continue to have individual champions, Your Excellency, in this country. And I'm thinking about the late Philip Bongole Lutaya. We have amongst us Major Rubaramira Ruranga. We have other people who have stood out. Yes, let's clap for him. That one is our hero. We have other people like Reverend Canon Professor Gideon Baguma Byamgisha, who have inspired many of us by keep coming out and speaking openly that they have HIV, to give HIV a face, but also to demystify this disease and erode the stigma that is associated with the disease. We are happy that the Global Network of People Living with HIV has come up with global partnership to eliminate all forms of stigma focusing on family, community, health facilities, workplaces. We believe that health facilities and workplaces should be stigma-free so that people can continue living good quality lives. These include the judicial and humanitarian settings. Once we combine efforts at local and national and international levels, we should be able to achieve the targets of ending both HIV and HIV stigma and AIDS by 2030. We are encouraged, Your Excellency, by the steps taken by Uganda AIDS Commission, who have developed the stigma policy and have rolled it out. We believe that this will influence both practice and behavior amongst our people so that nobody lives in shame and hiding because they have HIV in Uganda. We believe that as a community of people living with HIV, we are very organized, as I've already mentioned. We are written somewhere. We just need to be helped. For example, as chairman, I would like to talk to my people, but I can't because I don't have the means to do it. We need help. We need investment in helping these Ugandans who are living with HIV. There are over 1,400,000, and most of them are on treatment. And if they are helped, they can continue to contribute towards national development. We shall eventually all die, of course, but we shall not die of AIDS. We don't want to die of AIDS. We shall die like another person, but we don't have to die of AIDS. As I finish, I wish to wish everyone Memorial World AIDS Day, and we work towards ending stigma by encouraging people to have comprehensive knowledge of this disease, what causes it, how it affects people, and how people like me and others who are already affected can be helped to live good quality lives. The struggle continues, but we can and we shall manage. Your Excellency, I want to thank you. Together for a positive change. Thank you very much.
Okay, that was the chairperson of people living with HIV and AIDS, Dr. Watiti.
Permit me once again.
Now this year's celebrations is running under the theme End Stigma and End HIV and AIDS. Omubala gw'omulundi guno gugamba nti okukomya stigma ndooza nakiyita okuyisaamu mu bantu amaaso abo abawangaala n'akawuka akaleeta mukenenya n'okukomya mukenenya omwaka 2023 bwe gunaatuukira. Tukyakutuuka ku butereevu okuva wano Kololo mu kisaawe Kololo ku lunaku olw'okwejjukanya n'okwefumiitiriza ku kirwadde ekya mukenenya.
President of the Republic of Uganda, cabinet ministers present, heads of diplomatic missions, honorable members of parliament, all invited delegates, the Archbishop of the Church of Uganda and chairperson of the Interreligious Council of Uganda, ladies and gentlemen. Your Excellency, today is the second time that we are commemorating World AIDS Day scientifically since the outbreak of the COVID-19 pandemic in Uganda. During the 2 years since the first case of COVID-19 was detected, we've all been challenged by the pandemic, but we've managed to go about our work and adapted ways of survival. Now, more than ever, we are relying on technology to facilitate our work, including face-to-face meetings. COVID-19 has also impacted us physically, mentally, socially, and financially. Your Excellency, the COVID-19 did not spare the national HIV and AIDS response. However, Your Excellency, in the progress report I come bearing positive news. Because from the COVID-19 pandemic, we are emerging stronger. Our modeling data, working with UNAIDS and the Ministry of Health, shows that HIV prevalence has dropped to 5.4% in 2020 from 6.2% in 2016. However, there was also a decline in 41% HIV testing services and 37% referrals for diagnosis and treatment during the pandemic time. It's possible that the performance I've just spoken about above would have even been better. Your Excellency launched the master plan to end AIDS, and that's the Presidential Fast Track Initiative, in June 2017. In this master plan, Your Excellency, there are 5 pillars. You instructed us to engage men in HIV prevention and close the tap on new infections, particularly among adolescent girls and young women. The second was to accelerate implementation of test and treat and attain the fast track 90-90-90 targets by 2020. The third pillar was to consolidate progress on elimination of mother-to-child transmission of HIV. The fourth pillar was to ensure financial sustainability for the HIV and AIDS response. The last pillar was to ensure institutional effectiveness for a well-coordinated multi-sectoral response. And Your Excellency, I will spend the next few minutes just touching on each of these, showing examples of some of the achievements that we have realized to date. In terms of the first pillar of engaging men, when we looked at results for the last financial year 2020-2021, in addition to the male champions that have been engaging the men around the country, Your Excellency will develop a strategy for adolescent girls and young women, which had age-specific service packages and also expanded services targeting these adolescent girls and young women from 23 districts to 43 districts around the whole country. Overall, more than 300,000 young women were served in the following areas of intervention: HIV prevention, violence prevention, economic strengthening, vocational skills, enterprise development assistance, and for some of them, school subsidies for the vulnerable girls were provided. In addition to that, Your Excellency, there were, as part of the ABC strategy, there were 182 million condoms distributed countrywide. Under the second pillar, Your Excellency, I will share also a couple of achievements that were realized. Uganda was among 8 countries globally that achieved the 90-90-90 targets by 2020. Your Excellency, the other countries in the world are Switzerland, Slovenia, Qatar, Eswatini, Botswana, Malawi, and Rwanda. And Your Excellency, because of achieving the 90-90-90, you remember you personally led teams and chaired meetings at the AU in 2017. You chaired meetings at the UN in that same year. We've now set new targets based on the global strategy that was released recently. And we are now aiming to achieve 95-95-95 by 2025. And in the first year, a recent analysis was done, Your Excellency, for the year that has just ended. And the following are the results when you're looking at 95-95-95. Your Excellency, 95-95-95 is just referring to 95% of people who have HIV are tested and know their status, and 95% of those who test are enrolled on treatment, and 95% of those enrolled adhere to their treatment so that they achieve viral suppression and benefit from that. Your Excellency, the analysis showed that Uganda in the first year out of the 5 years is at 94 for testing, 98 for adherence of the 94, and then 84 for viral suppression. And we would like to acknowledge, Your Excellency, your support to the scientists, even during the COVID period and recognition. Most recently, we've had a national scientific conference where we had sharing, and we launched the research agenda, and we are continuing to build on that for progress. On the third pillar, Your Excellency, of consolidating progress on elimination of mother-to-child transmission, 96% of all pregnant mothers in Uganda attended antenatal care at the health facilities. They were tested, and all the HIV-positive mothers were enrolled on antiretroviral therapy. While during the postnatal period, 95% of breastfeeding mothers were virally suppressed. There is more work to do, Your Excellency, among the babies who are born of exposed infants. The number has reduced dramatically. In 2020, we had 5,300 babies who were born who were HIV positive, but that shouldn't happen. There are three main reasons why that happened, why 5,000 babies, approximately 5,000 babies became HIV positive. One is that in terms of retention, when these mothers enroll for some reason, some of those reasons are social, some are related to stigma and discrimination without the household, some of them have not disclosed to their spouses, they do not keep on treatment, they drop out. What the professionals call lost follow-up. The second reason, Your Excellency, why we have babies seroconverting is that not all the mothers becoming pregnant is a desired pregnancy. They are not accessing birth control. And that is a lot of work that we have to do at the community level to ensure that mothers becoming pregnant are only those who have desired it and planned for it. And the third one, Your Excellency, where the Ministry of Health is doing a lot of work, is the utilization of early infant diagnosis. There is equipment that has been procured. It is at health facilities, but it's not being fully utilized. Again, it's about campaigning and ensuring that the mothers are there in time to utilize this equipment. Your Excellency, the fourth pillar of financial sustainability. In the most recent financial year that has just ended, the total need for HIV, including treatment, prevention, and all the support services, were $732,934,498. 88.6% of this was realized, which is $649,042,108 from different sources, and the gap was about $83 million. The government of Uganda contributed to this, and government of Uganda contribution increased by 2% from the previous financial year, from $79.5 million equivalent to $81.2 million equivalent, which is about 12.5% of the total funding. Your Excellency, this estimation does not include the money paid as salaries to staff and also utilities and space and infrastructure. If that was computed, then the government of Uganda contribution would be much higher than what we see. But there were other areas, Your Excellency, under sustainable financing, which some work has been done. One of them is what we call HIV mainstreaming. It is working with sectors to ensure that they integrate services, they plan for HIV, and the Ministry of Finance has guided and instructed all government ministries, departments, and agencies to allocate 0.1% of their budgets to HIV AIDS-related activities. And in the previous financial year, about 38.9 billion Uganda shillings, an equivalent of about $10 million US, was mobilized. This money is not collected into a central place. it remains with the sectors and utilized at source for the different needs that they have. Uganda AIDS Commission has given them packages and guidance on how to utilize the funding. Your Excellency, the other initiative is a private sector-led initiative known as the $1 initiative. Soon after you launched the master plan, the private sector also said they needed to contribute. And they started the $1 initiative in 2017. They have since, and the patron for this who has led this, we have Professor Vaina Nantulia with us in the audience. Last financial year, they collected 116,658,510. The total they have in their basket is 226,374,260 in cash, and they have approximately 1 billion in pledges. These funds, Your Excellency, are supposed to be utilized by the private sector, but working with the Ministry of Health, they could agree on areas where they can be allocated. The target, when you speak with Professor Nantulia, is that they would like to reinvest this in an endowment fund and would want to have $5 billion in a 5-year time. But once this has not picked up, if it does, it's a potential huge source of funding for us. Your Excellency, the last item under financing is the AIDS Trust Fund. A law of Parliament was passed, regulations have been developed, and the responsible ministries are following up for the implementation of this. And once it is implemented, it will also be an additional source of funding for HIV and AIDS response. The last pillar, Your Excellency, and the directive you gave us was the institutional effectiveness for a well-coordinated multi-sectoral response. Your Excellency, in the last financial year, Uganda AIDS Commission coordinated the partners and developed the National Strategic Plan for 2021 to 2024-25, including the M&E plan. Your Excellency, all government ministries, departments, and agencies have HIV coordination committees. They have a focal person and they have a committee, and largely it is to look at the welfare of the employees of that institution, but also the communities that they interact with when they are doing their work. The same guidance has been given to the non-government entities, the private sector and the NGOs. Your Excellency, other examples of coordination structures include the partners. For instance, the development partners have a structure known as the AIDS Development Partners Group. And this is the equivalent of the Uganda AIDS Commission, but that serves that role for the partners. Your Excellency, you've just listened to His Lord the Archbishop. They have the Interreligious Council of Uganda. The people living with HIV have the National Forum of People Living with HIV. The private sector has the same. The cultural institutions have the same. The Global Fund Country Coordinating Mechanism and civil society, just to mention. There are 12 of them, and we have government ministries, departments, and agencies where the secretariat is at the office of the President. Your Excellency, as I come to the conclusion, we would like to focus and align to the NDP3, and we are following very closely the recent government guidance that is focusing at the parish for development. The Uganda AIDS Commission is developing a plan on how we can leverage this model because of its proximity to the household, where we need to have the families cushioned from the risk and danger of HIV. Your Excellency, we are harnessing the partnership I've spoken about by working with these agencies. If I can give the example of working with the Interreligious Council of Uganda, we've developed what is known as the pastoral letter. And the pastoral letter is a document that has HIV prevention messages that the houses of worship are using it to take these messages, whether it is a church service on Sunday, the Mothers Union, the Fathers Union, the home cells, the Darasa, the Mauledi, the Juma prayers, and all the other opportunities for communing with these agencies, and this is a powerful platform through which messages can get to the household. Your Excellency, with the cultural institutions, and in this audience, Your Excellency, there is the Minister from the Kingdom of Uganda who has graced it. We've worked very closely with the cultural institutions. The King of Uganda, for instance, and the King of Toro are UN AIDS Goodwill Ambassadors, and they have integrated messages into their campaigns while they are doing work in the kingdoms. We do this even for the 18 other gazetted cultural institutions. Your Excellency, as I end, let me make a comment on the teenage pregnancies. During the COVID-19 period, there was increased media reporting about teenage pregnancies, including violence, defilement, and this demonstrated for anybody who may have doubted that indeed schools are a safe space for our children. Your Excellency, as we wait for schools to open, the role of parents cannot be overemphasized. Appropriate parenting to support children is the foundation that we would like to focus on now. And we are going to work with different stakeholders, the mandated ministries like the Ministry of Local Government, the Ministry of Gender, Labor and Social Development, and others to tap into the parish development model, for instance, so that even as we distribute the messages and provide education and knowledge, we are also ensuring that households are cushioned against poverty and other vulnerabilities that predispose them to HIV and AIDS. In conclusion, Your Excellency, I would like to thank you very much for your exceptional leadership that you've rendered to this country to fight the HIV pandemic. I thank the government of Uganda for the prioritization and HIV mainstreaming agenda that we are having in the programs. Your Excellency, we are very grateful to the First Lady for her sustaining the fight for the prevention of mother-to-child transmission and consistently reminding us about good parenting. Your Excellency, the development partners have done a great job. They have stood with us in this trying time, and not to forget civil society and people living with HIV. I thank you for your kind attention.
All right, that was the Chairperson AIDS Commission. Now Uganda is commemorating World AIDS Day amidst another pandemic, and that is COVID-19. That also came with challenges, especially people living with HIV. They have been complaining that now the attention has been put onto the new kid on the block, and that is COVID-19. Of course, there is a report in decline in HIV testing due to the new pandemic, new kid on the block, and that is COVID-19. You may remember that during when there was a total lockdown, people could not even go to hospitals to access their drugs, that is ARVs, and all the other related services. Also, we've been informed that there's been a decline in referrals for diagnosis and treatment. There is a survey that was done by the World Health Organization, WHO, that put people living with HIV were
in a world
around 13% more likely to be admitted to hospitals. Let's listen into a poetry from a youth living with HIV.
People living with HIV is what kept me going. All protocols observed. Good afternoon, ladies and gentlemen. My name is Ruth Akulu, an economist by profession and a young person living with HIV from Oyam district, currently residing in Gulu. 21st January 2002, I say was the day my life and my family took a turn. It was on this day that I lost my father, the breadwinner in the house. He was a soldier working with the International Security Organization under UPDF. Due to society pressure and stigma, my father was secretly living with HIV which later advanced to AIDS without treatment. Neither my mother nor the rest of my family knew what my dad was suffering from. Due to his silence, on his last day, my father was also diagnosed with advanced TB, and it was too late for him to be saved. With TB added into the equation, his death was very lonely, ugly, and painful, a death I don't want to imagine now. Due to stigma, even while on his deathbed, he still didn't tell anyone about his status. He never knew that with his silence, his secret would end up costing his loved ones, especially me and my mom, because we both ended up infected with the virus. I was made to believe that he died because of a bullet, since I was still too young to understand what HIV/AIDS is. Due to ignorance and community myths, others believed he died because of witchcraft. Later on, my mom went through my father's medical documents to confirm the cause of his death, and that's how she found out about his diagnosis. She couldn't believe it and hesitated to go for a test. When she finally got courage and went for a test, she was also diagnosed with the virus. And later on began treatment, but she couldn't imagine that her daughter, her first daughter, was also living with HIV, was also infected with the virus. I was often sickly, but she would use local herbs to treat me. She couldn't afford quality treatment at the hospital because she had lost everything when my father died. Oblivious to my status, poverty, and lack of safety and security due to the effect of Coney War were the main reason my mom sent me to Kampala Children's Center in hope that I could get a better life and education, which I did. At the center, I was diagnosed with HIV during the entry process. My mom got traumatized when she found out I was also HIV positive and decided to ignore all my questions about HIV. And this is when I started experiencing very low self-esteem and other mental health issues like panic attacks, depression, anxiety, and suicidal thoughts. And this negatively impacted how I expressed myself to other people and made me struggle to open up even to my counselors at the health facility. I struggled with mental health issues. Till today, I still struggle, but right now, because of self-acceptance, it's at a minimal rate. I was one of those problematic teenagers, as described by the health workers, because I was struggling with my adherence, and my virus kept on going high. And I also struggled with accepting who I am due to the discriminative insults and attitude I encountered about people living with HIV. My turning point was when I read a book called The Purpose-Driven Life, and there is a line that really changed my life and says that experience is not what happens to you, it is what you do with it that happens to you. From that point, I decided to use my life experience to support my peers, especially those struggling with acceptance. I would like to thank Uganda Network of Young People for an innovative intervention, the Y Plus Beauty Pageant, which gave me a platform to come out as an ambassador for young people living with HIV, and I promised myself to utilize the platform to preach about self-acceptance as a person living with HIV and also advocate for the rights of people living with HIV. Through persistence, I got mentorship from different people who are already in the field, and they guided me. I was still a very timid girl by then. I was being able to be equipped with different advocacy skills and life skills. And just to let everyone know that acceptance is a process. I struggled, but I never gave up. I even became serious with my adherence because I was determined to lower my comrades off the cliff of stigmatization into safety, one at a time, bringing them hope. HIV stigma still prevents people living with HIV to live a life to their potential greatness. I want to make it known today that many young people today are orphans because of AIDS. So even when a child is negative, he or she still experiences stigma with an assumption that he or she is infected with the virus as well. And they are forced to face judgment at an early age while still mourning for their parents. Due to the heightened stigma and discrimination around them, they become runaway children living on streets with no security around them, increasing their risk to HIV as they are exposed to defilement and rape. For orphans living with HIV die early due to lack of access to treatment and no one to guide them or turn to for support. I want to thank Kapala Children's Center, founded by Pastor Onod Monge, who continuously supported me with love and understanding as a vulnerable orphan and made sure that I had uninterrupted access to HIV services. I also want to thank everyone who believed in me as an advocate, especially the team from Uganda Network of Young People Living with HIV, ICWEA, Philadelphia Family, and their partners for their mentorship and made me the person I am today. Finally, I would like to applaud people like Philadelphia. Even in the midst of extreme stigma in their generation, they managed to pave a way for us and made the world see that it's possible to accept oneself as a person living with HIV. Because of them, many young people living today, especially people living with HIV, have joined the fight to get rid of stigma and are openly living with HIV and are seriously advocating for their rights. However, there's still a lot of work that needs to be done to ensure that there is zero HIV-related stigma, especially in rural areas. For example, in my region, northern Uganda. My father couldn't make it, but I know, together with my fellow young people, with support from our duty bearers, we will drive out HIV stigma and discrimination by 2030, and once and for all. And to all young people living with HIV and have lost hope and still living in self-denial, I want you to know that there is hope and greatness lies in you. You just have to find it. Don't give up. Join the fight by religiously adhering to HIV treatment. I managed to overcome stigma. Others have managed. So you too can. Let's end HIV stigma. Let's end AIDS. Let's end the pandemic. I remain Ruth Akulu, the HIV advocate. Thank you so much.
All right, that is Miss Akulu from Northern Uganda, giving an account of how she has managed
Thank you very much,
to overcome
Ruth,
stigma.
There
are so many other young people who are here that have given testimonies.
At this time, invite
like
My Excellency Susan
my brother
Namondo,
Edwin Katamba, commonly known as MC Katz, was
the
here
UN
also
resident
to
coordinator,
give a testimony of how he has
and make her remarks.
tried hard to fight stigma. Ms. Akula has told us that she has been discriminated. She has been pointed the finger at by the people. Probably that's why this year's commemoration comes with a theme, End Stigma, End HIV and AIDS, which is matching with what we are hearing here about
Thank you very much. And
the
before
testimonies.
I start, just to commend the testimony of my
Let's
younger
listen
sister
into the UN
reminding us that
UNDP
while life throws
representative.
circumstances at you, it doesn't define you. It was a beautiful testimony. Thank you. Your Excellency, the President of the Republic of Uganda, honorable cabinet ministers present, honorable members of parliament, Your Excellencies, heads of diplomatic missions, the Archbishop of the Church of Uganda and Chair of the Interreligious Council, the Chair of the Uganda AIDS Commission, civil society representatives, all my own UN colleagues present, good afternoon. Let me begin by expressing our solidarity with the government of Uganda and renewing our commitment to work within the multi-stakeholder framework composing of government, development partners, the network of persons living with HIV/AIDS, civil society organizations, religious organizations, private sector organizations, all geared towards ending AIDS as a public health threat in Uganda by 2030. I commend you, Mr. President, for your personal commitment, openness, and unwavering leadership in the fight against HIV/AIDS in Uganda. I learned recently, digging from the archives, that the tide of the pandemic started to shift way back in 1997, before the arrival of ARVs in 2003. Thankfully, the HIV burden has been in steady decline from the 1990s to date, now at 5.4% of the adult population, if my figures are right. Last year, Uganda was among the 8 countries in the world that fully achieved 1990, the UN targets set for December 2020. This was an amazing achievement and was interpreted globally as Uganda is winning this thing. All eyes were on Uganda and counting on Uganda's leadership to lead us towards ending AIDS by 2030. This is commendable, and we should all be so proud and celebrate these achievements. And then the reality of COVID struck. After the last 2 years that we have lived, and quite frankly continue to live, we can't really fully enjoy the celebrations too much. We cannot afford to relax, and instead have to redouble efforts, because we rightly fear that some of the gains in towards ending the AIDS epidemic, like many of our development achievements, are being lost due to the impact of COVID-19. Your Excellency, we recognize the government's efforts in increasing budget allocations to health and HIV. We commend the government's efforts towards innovative financing mechanisms, especially by mainstreaming HIV in all program sectors, as mentioned previously by the chair of the Uganda AIDS Commission. My understanding, however, is that there's still a significant gap in the procurement of treatment of drugs. About $270 million needed to sustain the 1.4 million persons living with HIV, and the $39 million allocated by government of Uganda. I also understand, as has already been mentioned, that we are getting significant partner support in this area. The concern, however, is that a critical element of the response is still very dependent on external resources. And our hope is that the government will be able to increase allocation for ARVs to bridge some of this gap. We also recommend that the operationalization of the AIDS Trust Fund and National Health Insurance be expeditiously undertaken in order to ensure predictable and sustainable financing for the HIV/AIDS response amidst this COVID pandemic. We also note with concern, as has been mentioned before, the escalating rates of GBV and teenage pregnancy during this time of the COVID pandemic. Prior to the pandemic, young women and adolescent girls comprise 33% of all new HIV infections in Uganda. And the prevalence of HIV among women aged 20 to 24 was 4 times higher than men of the same age. While the reopening of schools next month will contribute towards the reduction of the higher rates of gender-based violence and teenage pregnancy we have seen during these years of lockdown, there is need to ensure that girls and young women in and out of school have adequate knowledge of HIV prevention measures. Needless to remind, the routes to teen pregnancy are the same ones that drive new HIV infection rates. Your Excellency, we also recognize the positive impact of free universal primary and secondary education and granting pregnant girls the right to return to school. We now understand there will be some challenges with back to school in some areas, and there will be need for additional budget allocations in the education sector in the upcoming financial year to ensure access by adolescent girls to free universal secondary schools across the country so that they can adequately complete the education cycle. We also need to address complacency from the public about HIV/AIDS, exacerbated by the necessary focus on COVID-19 over the past 2 years. Even as we continue to promote COVID-19 standard operation procedures, vaccinations, and now having to deal with a new variant of concern, there is need for coordinated efforts by stakeholders to revive public information campaigns about HIV/AIDS. There is need to ensure equitable access to HIV services for all those most in need of support, such as minority groups, women and girls, and other marginalized populations. In Uganda, the UN support is being delivered under the joint United Nations program on HIV/AIDS that works to achieve its shared vision of 0 new HIV infections, 0 discrimination, and 0 AIDS-related deaths. The joint program unites the efforts of 13 UN agencies and works closely with the global and national partners towards ending the AIDS pandemic by 2020 as part of the Sustainable Development Goals. And to get to 2030, I hope we can again collectively find the energy and enthusiasm led by you, Mr. President, and your government of those early days when the country was able to bend the curve of infections before the availability of HIV/AIDS drugs. No doubt the current development landscape is complicated. There are so many competing priorities, and all the issues are interrelated. HIV, the COVID response, education and skilling of young people, broadening and deepening the economy, the very tight fiscal space all governments have to navigate within, and security challenges. At this time especially, there is even greater need to really invest the energies required for enhanced coordination within government, between government and all her development partners. I really look forward to the government's necessary tweaking and reorganization of its development partner coordination mechanisms to facilitate our greater partner support and focus towards the priorities and the new circumstances that we have to deal with. Before ending, I reiterate again the UN's commitment towards ending AIDS as a public health threat in Uganda by 2030 by supporting national policies and programs. Thank you very much.
Countrymen and women, you're still watching us live from Kololo Independence Ground as Uganda joins the rest of the world to commemorate World AIDS Day. Like I was telling you,
permit me to invite
that
Her Excellency the Ambassador of the US government.
Uganda commemorates World AIDS Day amidst another pandemic that has come with challenges, and that is COVID-19. Told you already that there has been a decline in HIV testing, and because now the focus is put on the new kid on the block, like I said, and that is the COVID-19, and of course decline in referrals. Now let's listen
Thank you very much.
to the U.S. ambassador.
Your Excellency, the President of the Republic of Uganda, honorable ministers, honorable members of Parliament, my diplomatic and development colleagues, Director of the Uganda AIDS Commission, religious and cultural leaders, CSO representatives, all of the young people, the other distinguished guests, all protocols observed. Good afternoon. I'm honored to join you to represent the United States at this annual World AIDS Day event. The first ever World AIDS Day was celebrated in 1988, 33 years ago. Since then, World AIDS Days has evolved from an event steeped in sadness, marking the massive toll of AIDS on individuals, communities, and countries, to a day of hope and even celebration. We will never forget those who died or those who suffered when we didn't understand HIV and there was no treatment for the virus. And too many people continue to be infected by HIV, and even one death is too many. But today, we can celebrate the lives of those living with HIV, knowing that their future is not inevitable death, but rather long, productive lives to be lived to the fullest. This year, Uganda's World AIDS Day theme is End Stigma, End AIDS, End Pandemics. Achieving any of these 1 to 3 things is ambitious. Trying to achieve them all may seem overwhelming, but there's nothing wrong with setting ambitious goals, especially when lives are at stake. Looking back across the progress we've made thus far in the fight against HIV/AIDS, as well as the accelerated delivery of COVID-19 vaccines we are now seeing, helps us to remember where we have been so that we can appreciate where we are now. Perspective is so very important. It is really nothing short of a miracle to come as far as we have in response to COVID in such a short time. 20 months ago, the world was struggling to understand COVID, and today we have an effective vaccine and effective treatments with more than 7.7 billion doses given and 42% of the global population fully vaccinated. We know there's inequity in these figures, and we know more needs to be done. And that is why the United States has donated more than 235 million COVID vaccine doses to over 100 countries worldwide, including almost 6.5 million doses to Uganda alone. And because the U.S. is committed to sharing 1.1 billion vaccine doses where they are needed most to end this global pandemic, there are more doses on the way. So if you haven't gotten your jab, then get it now, especially if you're HIV positive or living with AIDS or otherwise vulnerable. Vaccines are available and they save lives. COVID is not behind us yet, but we can see the light at the end of the tunnel. So over several decades, the HIV epidemic has changed, and global collective efforts have helped replace death and despair with vibrant life and hope, and tragedy with triumph. AIDS-related deaths have declined by 64% since their peak in 2004, and new HIV infections have decreased by 52% since their peak in 1997. With nearly 2 decades of support across changes in American presidential administrations, as well as from the U.S. Congress, the United States has invested more than $85 billion in the global AIDS response through PEPFAR, and as the leading donor to the Global Fund to fight AIDS, tuberculosis, and malaria. This is the largest commitment ever made by one country to address a single disease. Through PEPFAR, the United States has saved more than 20 million lives, prevented millions of HIV infections, and supported many countries to reach epidemic control of HIV. In fact, this year, Uganda, despite the challenges presented by COVID-19, PEPFAR has overachieved its annual targets for HIV testing and initiating treatment for newly identified positives, with over 90% of newly identified positives beginning treatment. So epidemic control here is in sight. And over the last 18 years, we have come a long way in the fight against HIV/AIDS. And even during the past 2 years of COVID-19, we have succeeded and avoided significant setbacks, but we still have work to do. The End Stigma portion of this year's theme is where each and every one of us has an obligation to do more. Years ago, it was understandable that HIV-driven stigma and discrimination were widespread. The disease was not understood. It was infecting people and causing death at a rapid rate. That is no longer the case. Although we have not yet found a cure for HIV, we now better understand the disease, how to treat it, how to prevent it, and most importantly, how to live long, healthy lives with it. And yet stigma and discrimination remain, causing unnecessary illness, death, and social isolation. The primary cause for stigma and discrimination remains a lack of knowledge and understanding. The 2019 People Living with HIV in Uganda Stigma Index Survey found that of those individuals who failed to enroll for treatment within 6 months after testing positive for HIV, 74% said they delayed doing so out of fear of others learning about their status. Additionally, the survey found that in the previous 12 months, more than 20% of survey respondents missed a dose of their ART due to fear of someone learning about their HIV-positive status. To address the stigma all around us, we must make sure people know that they can prevent being affected by or infected with HIV. If they are unsure and afraid to know their status, we must help them understand the incredible life-changing impact of modern HIV treatment. And for those who have already been affected and infected, we must help them know that they can lead full and healthy lives. All of us have a role in promoting an inclusive and supportive environment. Unfortunately, those at highest risk for infection, including sex workers, intravenous drug users, and members of the LGBT community, have the fewest opportunities to seek treatment or are afraid to seek treatment or prevention services due to other drivers of stigma and discrimination. Policy actions that establish or increase criminal sanctions against these high-risk groups will only further decrease prevention, testing, and treatment opportunities. If we are to truly address the problem of stigma and discrimination, we must set aside our judgments of others and reaffirm the inherent dignity and fundamental rights of all humankind. Rather than casting those born differently or with different lifestyles in a shadow of judgment and stigma, we must extend our hand further to address the social and structure barriers that prevent them from accessing the HIV preventative treatment and support they need to live healthy, productive lives. Another part of promoting an inclusive and supportive environment is acknowledging inequities. So as we just heard from my dear colleague Susan, then in sub-Saharan Africa, 6 of 7 new HIV infections among adolescents aged 15 to 19 occur among girls. Around 4,200 adolescent girls and young women aged 15 to 24 became infected with HIV every week in 2020. Moreover, the 2018 Uganda Child Violence Survey reports that among 18 to 24-year-old females, more than 1 in 3 experienced sexual violence during childhood, and of those experiencing violence, only 1 in 13 received services. The survey also reported that those who experienced any violence, including sexual abuse, physical or emotional violence before or after the age of 18, were significantly more likely than those who did not experience violence to report an HIV-positive test result. Additionally, according to UNAIDS, in some regions, women who have experienced physical or sexual intimate partner violence are 1.5 times more likely to acquire HIV than women who have not experienced any violence. Today, World AIDS Day, it falls in the middle of the 16 days of activism against gender-based violence campaign, and we cannot ignore the linkages among violence, the health of women and girls, and HIV and AIDS, and how together they deprive women and girls of the opportunity to thrive. So how do we address the stigma, the inequities, and the violence? We must change behavior by acknowledging inequities, reducing fear, increasing knowledge, and shifting societal norms. However, the necessary social behavior change cannot happen without open and honest conversations at home, in school, which we look forward to reopening soon, in the workplace, in places of worship, within communities, and at the national level. These conversations need to occur between genders and across generations. We must all come together to stop violence and stigma and work toward greater equity. We will only end AIDS and end the pandemic if we can end stigma. Thank you.
That was Her Excellency, the Ambassador of US to Uganda, Her Excellency Natalie Brown. Now, US is one of the partners funding Uganda's fight against HIV and AIDS through the Global Fund. The other partners are the UN AIDS and so many
the Minister for
others.
Health.
Now, as
Dr. Ruth Acheng,
the Minister of Health, Dr. Jane Ruth Acheng Achero comes, Gwomulungi atulaba ku UBC TV, Nesta TV, tukyali wano Kololo, Independence Grounds, nga Uganda yegasse ku mawanga amalala mu nsi yonna okulaba nga tukuba tooki mu kaweefube w'okulwanyisa akawuka ka mukenenya. Mbadde nkyakugamba emabegaawo nti siriimu oba AIDS essaawa eno aliwo mu katuubagiro ka COVID-19 ekirwadde ekyo ssenyiga omukambwe Lumiima Mawuggwe bwe yajja n'asobya nti abantu ne batasobola kugenda kubatestinga kwegamba naye n'aleetawo challenges oba okusomooza okw'enjawulo. Katusooke tuwulize minisita w'ebyobulamu Dr. Jane Ruth Acheng Achero ayogereko gye tuli tujja kudda. Nze Dennis Blair Kalanzi.
Thank you very much, the Chair of the AIDS Committee, Your Excellency, the President of the Republic of Uganda, Honorable Ministers present, Honorable Members of Parliament, the Diplomatic Corps, our development partners, heads of government institutions, our esteemed religious leaders, Uganda AIDS Commission, members of civil society organizations, the private sector, all invited guests, ladies and gentlemen. Your Excellency, allow me to thank you for gracing this commemoration of the World AIDS Day. Your presence is a powerful reminder to Ugandans that though we have made progress, AIDS is still with us. It is also a reminder to all of us of your commitment to end AIDS by 2030. On behalf of the Ministry of Health, I join the people of Uganda and the global community in commemoration of today's World AIDS Day. On this day, we take a pause and reflect on the journey that we have walked together, the achievements we have made, and the challenges that we face in the implementation of the HIV response in Uganda. On this day, we also come together to affirm our collective solidarity with the people living with and affected by HIV and AIDS. We also fondly remember those who have died because of AIDS. Your Excellency, the Ministry of Health recognizes and embraces the 2021 World AIDS Day theme, End Inequities, End AIDS, and End Pandemics. And our local theme, End Stigma, End AIDS, and End Pandemics. This calls upon all of us to rally our support and solidarity towards ending AIDS. It also reiterates every individual's responsibility to protect themselves, their families, and their communities from acquiring HIV infection. The theme reminds us that although AIDS is no longer perceived as a death sentence, it is still with us and it is not yet over. On this World AIDS Day, I congratulate all the AIDS control stakeholders who have worked alongside the government of Uganda in addressing this big challenge. Together, we have made tremendous progress towards the HIV epidemic control and ending AIDS as a public health threat amidst a difficult environment caused by the COVID pandemic. And I want to thank all our partners who, together with us, came to address the challenge and put us back on track. As we close the year, we take stock of our achievements and the progress we have made towards attainment of the 95-95-95 goals. Since the HIV epidemic control in Uganda has not attained what we intend to achieve, we continue to make estimates of the numbers. Your Excellency, to date, 1.4 million adults and children are living with HIV. Adults aged 15 years plus accounted for 93% of this burden, with 62% of HIV-infected adults being female. It is estimated that about 38 new HIV infections occurred during 2020, 37,000 of them among adults. Young adults 15 to 24 years accounted for 41% of new HIV infections, with a male to female ratio of nearly 1 to 3. AIDS-related mortality dropped from approximately 23,000 in 2020 to 22,000 in 2021. Your Excellency, in implementation of the HIV programs, we continue to prioritize primary HIV prevention interventions. Last year, we continued to promote the ABC model of abstinence, faithfulness, and consistent use of condoms. We also intensified social behavioral change communication programs utilizing multiple media channels, including print, radio, television, roadside billboards, posters, leaflets, and interpersonal communication. We are grateful for the collaboration with civil society networks of people living with HIV, religious and cultural leaders in the implementation of these programs. The Ministry of Health has also been utilizing film vans to support HIV awareness in the country during this time of the COVID pandemic. Last year, additional film vans were procured, and 2 others are in advanced stages of procurement to augment these programs. The film van capacities are also being utilized in support of community mobilization for COVID-19 prevention programs, as well as other diseases, including non-communicable diseases. In a special way, allow me to appreciate the Global Fund, USAID, and UNFPA, who have supported the procurement and distribution of over 3 million condoms in the country. Condom distribution is done through total market approach involving the public sector, that is through national medical stores and joint medical stores, through the private sector and social marketing. For user end distribution, the Ministry of Health procured and installed an additional 4,000 condom dispensers across the country. Your Excellency, the Ministry of Health and partners, PEPFAR and the UN, have continued to provide safe male circumcision as a key element of the fast-track package for HIV epidemic control. There is significant evidence of its impact in reducing new HIV infections. Our approach has been to prioritize young men 15 to 29 years in regions with high HIV prevalence and high unmet need for circumcision. In the last year, 510,000 men out of an annual target of 850,000 were circumcised. A cumulative total of 6.5 million men have been circumcised since 2011. Your Excellency, the Ministry of Health has strengthened interventions for prevention of mother-to-child transmission. Testing for pregnant mothers has remained high at 98%, and enrollment to antiretroviral drugs for HIV-positive women is at 96%. We estimate that 5,300 perinatal HIV infections occurred in 2020. This represents a significant reduction in perinatal HIV infections from a peak of 28,000 in 2010. We shall continue to address the factors that contribute to breakthrough infections. Towards these efforts, we shall conduct sustained HIV testing and enhancement of retention on treatment for pregnant and breastfeeding women. Your Excellency, we have continued to strengthen the implementation of HIV care and treatment program. In the year, we completed and embarked on full-scale implementation of the 2020 Consolidated Guidelines for the Prevention and Treatment of HIV and AIDS in Uganda. These guidelines provide for the transitioning of patients to more efficacious and optimized HIV treatment regimens. The number of adults and children active on ART increased from 1.22 million in 2019 to 1,280,000 in 2021, a coverage of 91% of all HIV-infected individuals. Of these, about 93% are adults, 15 years plus, while 7% are children aged 0 to 14 years. The number of ART treatment facilities were 2,015 across the country. In the coming year, the Ministry will focus on bridging program gaps among men, young people, and key populations. We will strengthen the identification, linkage, and retention of men and adolescents in HIV treatment cascade. Your Excellency, during the year, we also prioritized the collection of vital strategic information to guide strategic planning and monitoring of HIV epidemic control activities. The Ministry has continued to strengthen the routine data collection systems through the district health information systems. The 2009 annual Sentinel surveillance survey was also conducted, and it provided data that we utilized in the production of the annual estimates that you have been hearing. In the area of generation of strategic information, we remain committed to the provision of evidence that informs our HIV programs. Against this commitment, the Ministry conducted a national population-based survey of HIV/AIDS in 2020, what we call the UFIA, to provide empirical population-level data on a wide range of program indicators. The findings will be available in early 2022 to inform the future of the program efforts in a fundamental way. Working with stakeholders under the guidance of the Prime Minister, UBOS, UNHCR, CDC, and ICAP, the Ministry is conducting a population-based survey among refugees to determine the magnitude of HIV and other program indicators among the refugees in Uganda. And this will be communicated as well. The data collection will be completed during the later part of 2021 and results communicated accordingly. The HIV case-based surveillance involving longitudinal follow-up of people living with HIV was successfully piloted in the CDC-supported areas of Kabarole and Hoima districts, including the use of unique identifiers. The future direction involves working with stakeholders on establishment of a central data warehouse and an enterprise architecture as a key feature of the program. Despite all the efforts and burdens of HIV/AIDS, the epidemic remains enormous. Your Excellency, in a special way, allow me to thank the United States government through PEPFAR, the Global Fund, and the United Nations, WHO, UNAIDS, UNICEF, UN Women, and UNFPA, who have greatly supported our response to HIV. We also appreciate the bilateral and multilateral partners, including Ireland Aid, the World Bank, and FCDO for your unwavering support. Allow me also to appreciate the networks of people living with HIV and the private sector that are contributing to this response. Lastly, Your Excellency, allow me once again to extend our sincere appreciation to you for your extraordinary leadership in the fight against HIV/AIDS in Uganda and all the pandemics that we have and may continue to have. And allow me to remind all Ugandans to take a step and get vaccinated against COVID-19. The vaccine is widely available, and the vaccine that is given to you is the best vaccine. I thank you all for listening to me, for God and my country.
I thank you, Dr. Ruth Acheng, for those remarks. Your Excellency, as part of the preparatory activities for World AIDS Day, 200 young people drawn from the 5 divisions of Kampala underwent 5 days training in HIV prevention, patriotism, and mindset change. This initiative was supported by by the Patriotism Secretariat under the Office of the President, Kampala District Youth Council, Uganda Scouts Association, and Uganda AIDS Commission. The trained youths are going to mentor 10,000 other youth in HIV prevention, patriotism, and mindset change in the 5 divisions of Kampala, and we believe this can be achieved by 30th December 2021. Therefore, Your Excellency, we shall request you that at the end of your address to the country, you will perform another cardinal role of passing out these young men and women so that they can go out there and create a change in the minds of other youths in the issues and in the area of HIV and AIDS. Therefore, Your Excellency, allow me at this time invite Honorable Mile Babalanda, the Minister in charge for the Presidency, to come and make her remarks, but also introduce to us the other ministers who are in the gathering with us to you, and thereafter invite you to address the nation. Thank you very much, Your Excellency. Honorable Minister, you're welcome.
Your Excellency, the President of the Republic of Uganda, Commander-in-Chief and National Chairman of the mighty party NRM, retired General Yoweri Kaguta Museveni. Cabinet Ministers present, Your Excellency, among the Cabinet Ministers we have here, we do have Honorable Dr. Jane Ruth Acheng, Minister of Health. Honorable Dr. Mori Kukaduchu, Minister of State for Primary Education. Honorable Mary Grace Mugasa, Minister of State for Public Service. The Archbishop of the Anglican Church and Chair of the Interreligious Council, ambassadors present, the UN Resident Coordinator, the Chairperson Parliamentary AIDS Commission Committee, members of Parliament present, the RCC Kampala, permanent secretaries, all development partners, the Senior Mayor, Kampala Central Division, the town clerks, representatives of people living with HIV, ladies and gentlemen. I am honored and privileged to welcome all of you to this important day when we commemorate the World AIDS Day in Uganda. I wish to thank the Uganda AIDS Commission and our partners for organizing this colorful event amidst the COVID-19 pandemic. Each year, Uganda AIDS Commission, under the Office of the President, mobilizes partners at national and subnational levels to observe and participate in activities marking the World AIDS Day. This event provides a powerful advocacy platform to awaken communities in the fight against HIV and AIDS and to reflect on our successes and challenges in the fight against the pandemic. Your Excellency, we applaud your strong leadership in the fight against HIV and AIDS, which has been demonstrated globally since the onset of this pandemic. You rallied all Ugandans to come together to fight this common enemy, and indeed, a lot has been achieved, as reported by the Director General of the Uganda AIDS Commission. To our development partners, we wish to appreciate your unwavering support to the government of Uganda in this area. We pledge to work with you in the fight against HIV and AIDS and other pandemics. As government, we recognize all the contributions and all the support you have rendered to the HIV/AIDS response. Your Excellency, since I assumed office, I have seen and I hereby commend the partnership approach government adopted and is implementing through the Uganda AIDS Commission to bring all the partners together to work towards achieving a common goal. I receive monthly reports from the Uganda AIDS Commission on key strategic areas that stakeholders are engaged in, including government and non-government institutions that are tackling the AIDS pandemic in the country. I would like to say that indeed, great success and progress is being made. I therefore congratulate and I urge you all stakeholders to continue working and supporting those infected and affected by the HIV for the betterment of our country and for attainment of the Vision 2040. However, Your Excellency, there are those friends of ours in the name of partners who had made it their cause to use the AIDS platform to steal from donors and the people infected and affected by the AIDS problem. I accordingly directed the Director General of the Uganda AIDS Commission to strictly regulate operations of our stakeholders and to deal with the problem of fake AIDS organizations. Ladies and gentlemen, this year's National World AIDS Day theme is End Stigma, End AIDS, End the Pandemics. I appeal to all of you to recognize and support the persons living with HIV and AIDS in various ways, including the following. Let us recognize the 1.4 million people living with HIV in Uganda. This will ensure that they come out of hiding in order to access HIV services without any fear. Let us offer them maximum social and emotional support in order to promote their dignity and positive living. Let us stop stigmatizing them. Ladies and gentlemen, in line with the above, the country has put in place measures to ensure HIV is mainstreamed in all sectors under programs of the Third National Development Plan. At this point, I wish to recognize the efforts of the members of Parliament under the leadership of the Right Honourable Speaker and the committee chairpersons who have promoted the AIDS agenda in legislation. You have supported the national cause for HIV and other pandemics. Please continue to offer this badly needed leadership and guidance, especially our young people who are our future leaders. I wish also to thank my colleagues, the ministers and all the government officials who supported and continue to support the people living with HIV and AIDS during the COVID lockdowns. The communities of people living with HIV and AIDS express their gratitude for your involvement and assistance. Indeed, Your Excellency, I have challenged all our leaders to always dedicate at least 2 to 5% of their public speeches to issues of HIV and AIDS as one way of re-energizing the message of AIDS in the population. To the people living with HIV and AIDS, I wish to thank you for standing firm, shining and contributing to national development. You have given your views and proposals on where the interventions and focus should be in order to attain results. Our chief guest, sir, as I conclude, I wish to mention that your wisdom and leadership made Uganda to be among the 8 countries in the whole world that achieved the global target of 90-90-90 by December 2020. This is to say 90% of the population gets tested for the virus, and 90% of those who test positive are put on treatment, and eventually 90% of those on treatment are able to sustain on that treatment. Your Excellency, we have now adopted the new global targets of 95-95-95. Indeed, Your Excellency, after all these achievements, and with only 9 years left to the national target of completely ending AIDS as a public health problem in 2030, the Uganda AIDS Commission, at my proposal, is planning to document and put on record for the future generations all the atrocities committed by this virus to the people of Uganda since 1980. The Uganda AIDS Commission is planning to establish the first ever Uganda AIDS Memory Museum. This museum will showcase and explain to our young generation who did not see and neither feel the toughness and effects of this terrible pandemic, especially in the early days of the 80s. The museum will also document the long journey of the NRM government and especially your leadership in the battle against this enemy. The Uganda AIDS Commission already has land in Kampala City where this project can be established, but will need funds to construct and equip the museum. Your Excellency, despite all the above, however, the master plan for ending AIDS as a public health threat by 2030 still requires heavy financing and human resources. Resources will be needed to achieve the targeted interventions which are highlighted in the National HIV Strategic Plan 2020-2021 to 2024-2025. I therefore call for increased facilitation to the national response and adequate funding of the Uganda AIDS Commission, sir. Your Excellency, in support of your initiative to end AIDS by 2030, Kampala Capital City Youth, with the support from the Uganda AIDS Commission, the Uganda Scouts Association, and the Uganda National Patriotism Secretariat, trained 200 youths as peer mentors in HIV prevention, patriotism, and mindset change. This training took place at Kaz Scouts Ground. Representatives of these youth from the 5 divisions of Kampala are here today, and I request you, sir, to commission them after your speech. The trained youth will take the message of HIV prevention to the 5 divisions of Kampala. It is anticipated that at least 10,000 youths will be reached and skilled in HIV service utilization by 30th of December 2021. Sir, on behalf of the Uganda AIDS Commission, and as the Chief Coordinator of all the agencies in the fight against HIV and AIDS, allow me to commend you for the great effort you have displayed in the fight against the COVID-19 pandemic. However, I need to report to you that while we focused on the COVID-19 challenge, there was a big laxity in the fight against AIDS. We do have fears that due to the effects of the lockdowns, there may be a resurgence in HIV infections countrywide, just like it has happened with the teenage pregnancies. And now with the new COVID strain of Omicron doing the rounds, we need to double vigilance, especially through the media, to counter its impact on our already vulnerable society and especially on the AIDS situation in the country. Your Excellency, because of the seriousness of this matter, I have been engaging leaders in forums organized by the Uganda AIDS Commission to remind them of their roles in the fight against HIV and AIDS, and I have commissioned them to be HIV AIDS ambassadors in their communities. I have had good support from the Speaker of Parliament, the Right Honourable Jacob Bolanya, who has been very instrumental in mobilizing the members of Parliament to support the activities, of the Uganda AIDS program. I am, however, challenged to report to you, Your Excellency, the health workers and other caregivers, especially in our up-country stations, who continue to mistreat and stigmatize HIV and AIDS patients. This is counterproductive to the targets we have set to end AIDS by 2030 and should be stopped. It is now my honor and privilege, Your Excellency, to invite you, the acclaimed Global AIDS champion, to come and address the nation. I thank you.
Thank you. The honorable ministers, the members of parliament, His Grace the Archbishop and the religious leaders, Excellencies the ambassadors and heads of missions, representatives of people living with HIV/AIDS, all representatives from government ministries, departments and agencies, all invited guests, ladies and gentlemen, including all of the people attending online. I'm pleased to join you today at this important event where Uganda joined the rest of the world to raise awareness again of the AIDS pandemic caused by the spread of the HIV infection and remembering those who have died of the disease. Today marks 33 years since the commemoration of the first World AIDS Day in 1988. It is approximately 40 years since the first case of AIDS was discovered in Uganda in Kalisis Hospital, coming from the shores of Lake Victoria in Rakai district. My story with AIDS starts around 1983 when we were in the bush fighting. There was one of our soldiers who got sick, and the doctors we had in the bush tried everything possible to treat him. They treated malaria and many other things, but they could not know what the person was suffering from until the person died. I remember that boy very well. He was called Black. We couldn't know what this sickness was that could not respond to all the known treatments. We came to know that when we were going to the bush, this soldier had hidden in Rakai district, which at that time apparently had become the epicenter of the epidemic. We did not know that time what had killed that soldier. I tried to talk to Dr. Bata and Dr. Vesige about this boy, but nobody had an explanation. I'm always interested in health issues. Then around 1984, I started hearing on the radio that there was a new sickness of homosexuals which had no medicine. You know, that's how the whole story of AIDS started here. I said to myself, that's no problem. We don't have many homosexuals here. So I didn't bother so much. Around 1985, I was listening to the BBC radio program, and there was a female doctor in Zambia from Italy. I think her name was called Dr. Ombeli. I had her on the program of BBC saying, no, this disease does not affect only the homosexuals. I have seen a number of patients who are not homosexuals in my clinic. I called my army officers who were with me in the bush, and I warned them. I said, there's a new sickness which people were originally saying it was for homosexuals, but now I have had a doctor in Zambia saying that she has seen people who are not homosexuals who have been affected by that disease. Then I forgot about the problem, and we were busy with other things, including taking over Kampala, until September 1986, when I had gone to attend the Non-Aligned Movement Conference in Harare, Zimbabwe. During the conference, the late Cuban leader, Dr. Fidel Castro, took me aside and told me that there is a big problem in my country. That's what Castro actually is the one who told me. Fidel Castro, in Harare, September of 1986. How did Castro come to know about this? Apparently, we had sent 60 soldiers from here to Cuba for training. For us here, we were not checking for AIDS, but the Cubans were already aware, and they were checking all these people. When our soldiers went, 6 of them were tested, and 18 of them were HIV positive, which is 30% of the 60. Dr. Castro's system was very efficient. He told me that those 18 were going to be sent back, and the others would stay and finish their course. When I came back, I called a meeting in Republic House, the Minister of Defense, and we had a meeting with Dr. Okware. Is Dr. Okware here? That's a veteran of our struggle. When I called Dr. Okware, I interrogated him. Because now I had started hearing that the AIDS was spreading through blood to blood, that the blood of the infected person, if it mixes with the one who is not infected, the other one will be infected. So I asked Opare, these doctors of Uganda are good, but they don't know how to communicate. This is their problem. I said, if that is the case, then that means that the mosquitoes can spread this AIDS. Opare said, no, mosquitoes cannot be spreading the AIDS. Why? He said that because in the households where people are dying, the children don't die. It is only the adults who die. This means that whatever is killing them does not affect the children. And we think it is because the children are not sexually active. That's why they are not dying, and yet they are in the same household. If it was, if mosquitoes were involved, even the children would be affected. So then I said, but if you knew this, why didn't you talk about it? He said, yeah, we'll put some few announcements on the radio saying, love carefully. There are some whisper on the radio. I said, Dr. Kwade, but this one, once the lion comes to the village, you don't whisper. You make alarm, enduru. So that's when I went out. Actually, that's why we put the AIDS Commission in the President's office, not in the Ministry of Health, because we could see that the issue here now was enduru. Enduru is a word for alarm. And since Ministry of Health people are not famous for enduru, they just whisper. We say, no, you put it where people who can shout. And shout intersectorally. Because this was not just a health issue, it was an awareness issue. Because now we came to understand that really there were only a few ways in which the AIDS was spreading. Number one, the main highway, the Wanyankole call it Umuhanda Ligendwa, the main highway of HIV spreading was sex. That was the main road. The second one at that time was blood transfusion. So with blood transfusion, we quickly got how to handle it by checking the blood of people who are donating blood. And then for some reason, and this is where I had my argument with Okware, the injections, at that time they were using reusable syringes. So my arguments with Okware was, but if the mosquito doesn't spread the virus, but why would the syringe do so? And Okware had the answer. The answer was the proboscis of the mosquito is very small. It does not have too much, does not carry too much blood, while the syringe is bigger, can carry more virus. So that is the story of AIDS here. From that time, we decided that Enduru was the main weapon. The alarm, talking. Then with the story of AIDS, we continued. When the ARVs came, we were told that somebody to use them must keep testing until his CD4 count falls to 500. You know, we're really involved in all these battles. When the ARVs came, they said, no, we keep monitoring the patient until his CD4 count goes 500. And then we said, what is the normal person supposed to, how many are his CD4s? I think that time they told me 800 or something like that. That when they reach 500, that's when he should start using ARVs. I asked them, why does he not start from the beginning? They said that these ARVs are also poisonous. They fight the AIDS virus, but also do damage to the body. So it is better the body fights on its own for some time, and when you see it is losing, then you come in with this weapon, which kills the virus, but also damages the body. Now, much later, it is Michel Sidibe, I don't know where he is now, who told me that the strategy had changed. This was much later, like 6-7 years ago. He said that now, as soon as you test and you find that you have the virus, you take the drugs. Then my question was, what has happened now? Because the other time they were saying the drugs were also very bad. They said drugs had come, I think better drugs, and when you take them, it is better than when you delay. I think the drugs had become safer or what, something there. Now, for some reason, I had not heard this from, this is really the problem. The problem, because I got this from Sidibe. Sidibe, you know, Sidibe is an expatriate from somewhere. But here within Uganda, nobody had told me this. This is part of the problem, where the one who knows doesn't talk. Keeps the knowledge to himself. I think it makes people very important. I got this from Sidibe. You can even check. It's not long ago. It's about 8 years or so, much recently. So I would like to recognize those who joined and tirelessly fought AIDS to give Ugandans hope. For example, Mrs. Norin Kareba. Is she alive? She's alive. For coming up with the idea of the AIDS support organization TASO. That gave Ugandans hope. Now, Michel Sidibe now told me two things. First of all, that it is better to start from the very early, swallowing the drugs. And then secondly, that apparently, which is what people are now repeating here, that the ones who are taking the ARVs apparently don't pass on the virus, don't infect others. But this was new information, which they were not talking about here until this CDB came. At that time, he was working with a Kenyan girl. There was a Kenyan girl there. Then I said, but if that is the case, then things are easier now. If, number one, the drugs are safer, you can swallow from the beginning, and then once you swallow, then you no longer infect, then that makes the battle winnable. We have therefore come a long way, but I think behind all this is a defective strategy of not understanding the importance of public health, getting health by involving the public, sensitizing the public. Once the public know what to do, things are much easier. You will save a lot of. But some of the health workers prefer to keep quiet so that they are rich in patients. The more patients you have, the better. And many of the patients are patients because of ignorance, because they don't know what to do. That's why you even hear that in Uganda people have got malnutrition. Malnutrition, why? Here we've got all the foods are here. But the people are not told what to do. So, and as you know, 80% of the diseases which affect Ugandans are preventable. And many of them are preventable by behavior change or knowing what to do. We have therefore come a long way in fighting against HIV and AIDS, and today I can say with confidence that we are winning this battle. If there has been a relapse during the corona, then we shall regain. There are about 37.7 million people who are living with HIV globally. 1.5 million of the people were newly infected with HIV in 2020 alone. 73% of the adults living with HIV received lifelong antiretroviral therapy, and 680,000 people died from HIV illness. In Uganda, HIV prevalence reduced to 5.4% in 2020 from 18% in the 1980s. 1.4 million people are living with HIV in Uganda, and of these, 1.2 million are on treatment. Of course, the number in Uganda is growing of the people living with HIV because it is cumulative. People are no longer dying. They are no longer dying. So it's not like in the past when so many people would die. The main message for